住落嚟咧，嚟到我哋嘅開幕論壇啦。以下嘅環節咧，我哋會主要以英語進行㗎。咁今日好開心啦，我哋邀請到嚟自本地啦、國內啦同埋日本嘅分享嘉賓。如果需要傳譯耳機咧，都可以去到嗰邊嘅接待處借取耳機嘅。今年我哋嘅活動咧就以10年創新從銀到金為主題啦，同官商民學研等唔同嘅界別一齊為老齡化嘅議題尋求良策。面對人口老化、勞動力不足嘅挑戰，我哋需要採用敏捷嘅思維同埋創新嘅意念，引領香港發展為亞洲智齡城市，創建更加美好嘅將來。喺呢一個10週年嘅重要時刻，我哋希望進一步推動跨界別嘅合作，鼓勵黃金一代喺人生嘅下半場繼續積極參與，持續貢獻社會。我哋相信透過科技、設計、醫療、教育等等唔同嘅領域嘅創新方案，可以開拓更多元嘅第三人生選擇，提升黃金人士嘅生活質素同埋社會參與感。同時間我哋都期望啦，透過今次嘅盛會可以匯聚嚟自本地啦、海外啦嘅創新實踐者，分享成功經驗，激發更多共創嘅機會，我哋一齊去攜手推動智齡創新嘅發展，為邁向可持續發展同埋共融嘅未來奠下堅實嘅基礎。咁接住落嚟我哋會邀請我哋嘅分享嘉賓嚟到。今日好開心啦，每一位嘉賓都係非常之重量級㗎。我哋首先邀請我哋嘅主持人，黃金時代基金會創辦人及主席容蔡美碧教授。與此同時，我哋會繼續邀請我哋嘅分享嘉賓，日本福岡市荒瀨泰子副市長 Dr. ARASE Yasuko, Deputy Mayor of Fukuoka City from Japan。冠名贊助機構中銀集團人壽保險有限公司執行總裁鄧子平先生。好，亦都會繼續我們繼續邀請中國人民大學人口與健康學院院長杜鵬教授。同一時Rebecca 話，與其係佢主持，不如揾一個更加有份量嘅主持人嚟。我哋邀請黃金時代基金會董事、香港中文大學賽馬會公共衛生及基層醫療學院專業應用教授馮康醫生 JP。有請馮醫生。多謝你。咁與此落嚟啦，我哋就將個時間交俾我哋嘅主持人啦。Thank you.
Thank you very much. Today we are very much excited and honored to have both local and also representatives from Japan and also from the mainland experts in the area of aging and with vast experiences in this area to share with us. I think we are at different stages of aging. Hong Kong is, of course, recently listed as probably the area, the jurisdictions with the longest longevity in the world, parallel with Japan. And, but there's a lot of advancement and innovations that have been developed in Japan in recent years. And locally, recently we are catching up as well, and sponsored by the industry, like BOC Live and all that. And of course, Professor Du actually had a lot of very detailed studies, understanding China is catching fast on this as well. So it's actually a challenge for the countries in East Asia, and how are we going to address all that? So we have a very good sort of a live sharing sessions that follows. Now the session will be conducted in 3 languages. It will be in English, can be Cantonese and Putonghua as well. Yeah. So make sure that if you don't have the, you need the instant translator, then you have it on. Yeah. So first of all, let's ask Dr. ARASE to share with us her experience from Fukuoka City, the very famous and also important 100 project that lead to preparing all of us for the 100-year era, which all of you sitting here in the audience are expected to live till 100 years old. how are we going to live, towards 100 years old, and here is the experience. So maybe we can invite Dr. ARASE to actually share with us first. Yes.
Good morning, everyone. Thank you very much for this wonderful opportunity. I'm so nervous now. Today, I talk about Fukuoka 100, our attempt to take on Japan's super society in 2040. Japan is a rapidly aging area than any other country. However, over next 20s, Asia's rate of aging is predicted to rapidly increase. Fukuoka and Hong Kong. Hong Kong is predicted to age as much faster rate than Fukuoka in future. Let me return to Japan. Average Japanese life expectancy. The era of the 100-year life is the last right ahead of us. Japan has a medical and welfare system. One is a national health insurance system. All residents have early access to medical care anytime and anywhere. This has led to an increase in average life expectancy. Now, how to live, how to spend a long period of old age are important issue. Another, long-term care insurance system. Anyone can receive nursing care when needed. Japan's long-living society is built around these two insurance systems. We have three key years. 2000, long-term care insurance system was established. This was a huge change, socialization of care. 2025, when the baby boom generation turned 75 years old. 2040, when those over 75 will peak, and we will be faced with extremely low birth rate and aging society. So, we did policy shift. We provide service when they are needed, such as providing employment support for the elderly. In 2017, we started Fukuoka 100 project. It was started by all Fukuoka team, including business, academia, and government. In the center of the fort are Mayor Takashima and me. At start, we created an information platform. We centralized the big data owned by Fukuoka City, medical, nursing care, and health checks. And it's possible to analyze and evaluate the data. 7 years have passed. The data analysis is underway. Analysis is being conducted in cooperation with Public Health Department of Kyushu University. One example, we analyzed the factors that increase the need for long-term care in Fukuoka residents. We found people who are underweight needing care risk 2.17 increase. Walk slower than those of a similar age, needing care risk 1.86 increase. Decreased chewing ability, needing care risk 1.51 increase. The reason needing nursing care, for men, it is lifestyle-related disease such as hypertension and diabetes. For women, the first is a locomotive problem, bone fracture due to osteoporosis. Second is dementia. From here, I will introduce 3 major projects. The first, the bench project. There are various types of bench. Bench are essential for the old age. To date, we have installed more than 500 benches. As bus stop, our resting bench make going out and walking more enjoyable. Second is a fitness city project. It aims to create a city where people can become healthy just by living there. There are many places in the city where we can exercise. It is only for a limited time. This is approach to enjoy physical exercise. The right fourth, the piano sound play as you walk. The third is the oral care 28 project. You know, number of permanent teeth are 28. Teeth are very important even in old age. Having own teeth allows us to choose properly, enjoy conversation, and prevent aspiration. Keeping all 28% teeth through life is extremely difficult. It aims to prevent periodontal disease, which is a major cause of chewing difficulty. So, we tailored policies to each life stage. Lastly, the greatest issue is the super age society in the increase in dementia. The increase in dementia is unavoidable. Research shows the percentage of people aged 75 and older with dementia in Fukuoka. By 2040, it is predicted to reach 28%, and older people living alone increase. Dementia measures are necessary. We are promoting a dementia-friendly city project. Dementia measures requires both physical infrastructure and soft approach. As for soft side, we have adopted Humanitude, a communication care method originated from France. In the center, you can see Humanitude being taught at elementary school. Of course, we also recommend it for care in facility. We are also working on dementia-friendly design, dementia cafe, peer support, and early detection. Dementia-friendly design is the second edition here. For people with dementia, the location of the restroom is very important. Experts have studied how signs should be designed, such as the color, size, and angle, to make them more visible within the field of vision. Inside, contrast is used to make it easier for people with dementia to understand. Designs like this are included in previous mentioned design collection. And in September 2023, we opened the first dementia-friendly center in all of Japan. Here, they offer consultation, workshop, interactive session, and information about dementia. The center also creates job opportunity for people with dementia. This is AR-based workshop that allow participants to experience the state of dementia. Using AR, we can simulate the visual experience of people with dementia, how certain colors become harder to see, how the field of vision narrows, how it becomes difficult to perceive distance. If you wear these AR glasses, you will experience how the different world looks and feels to someone with dementia. And there is a robot. It approaches when its name is called. It communicates through various emotion expressions. Interacting with robot helps increase conversation and smile among people with dementia. They are dementia, but their activity contributes to society. We will continue to improve our approach toward the future. Our keywords are evidence, education, prevention, and coexistence. Thank you so much.
Thank you, Dr. ARASE. I think the project 100 projects preparing for 100 years is really inspirational, and it's a lesson for every one of us to learn. 咁跟住落嚟咧，我哋請中人壽我哋嘅即係冠名嘅贊助人鄧先生，就同我哋分享一下。咁以前咧有睇過個廣告咧，就話養大一個小朋友咧就要400萬喎，400萬。咁我而家問一問題就係，如果我60歲退休咧，400萬夠唔夠我活到100歲咧？咁啊咁啊，鄧生會幫我哋解決呢個問題啊！
好多謝馮醫生。
請阿鄧生。
OK 好嚇。咁或者我答你呢個問題之前，或者我哋先睇一睇而家香港暫時話講緊老齡化啦，個狀況係點樣樣咧嚇？或者我哋可以睇一睇個 slide 係咪已經 OK 係嚇？第一頁唔該嚇。係。或者睇一睇咧，就我哋比較一下3個地方都係進入緊老年化啦，就係講緊香港啦、日本同埋中國啦，係中國香港嚇。咁呢幾個地方咧，如果喺而家喺2020嘅時候咧，如果睇一睇我哋嗰個65歲佔整個人口比例啦嚇，咁就日本係比較領先啲嘅，即係佢哋個老年化係比我哋行得早嘅嚇。咁佢哋有28.7% 係即係65歲以上個人口嘅嚇。咁香港大約20% 啦嚇，咁就中國整體就大約17.9%。咁但係有一點去睇一睇喎，咁我哋咧就追得好快喎。你睇下，如果去到2025年咧，跟翻如果冇乜特別大嗰個，即係一啲大嘅或者移民政策各方面嘅話咧，咁去到2050年嘅時候咧，其實咧我哋已經香港咧就變咗有40%，有40% 係65歲以上嘅人口嚇，即係佔咗我哋嚇。咁所以你可想而知，由啲30，即係喺嚟緊，我哋喺面對緊我哋嗰個。即係嗰個老年化嗰個速度咧，係喺咁多個地方應該係最快嘅咯，應該你睇下，因為我哋喺中間可以咁樣追到上嚟嚇，咁所以就我哋嗰個面對係有一定嘅挑戰嘅嚇。咁下一頁唔該嚇。咁嗱另外有幾樣咁大家知道嗰個老年化嘅進程啦。第二個想同大家分享一下咧，就係我哋亦都有2個現象啊。第一個現象咧就係我哋係長壽啦，香港人嚇，香港人好長壽。我哋平均個 life expectancy 咧，即係嗰個年紀咧，就去到85.3歲。咁其實如果你分開睇咧，其實女士咧應該係再長壽啲嘅，佢89嘅，真係我冇記錯嚇。咁啊，正話日本嗰個去到已經過咗90嘅嚇。咁喺即係你哋大家要即係會 expect 會，我諗在座所有包括我自己啦嚇。咁我哋要 expect 我哋會活得比我哋想像長啊，有機會係嚇，特別有醫療嘅一啲突破嚇。第二個點解我哋會追得咁快喺個老年化嚇？就係第二樣嘢咧，就係個出生率你睇下，咁啊係0.8嚇。咁啊，其實咧就如果人口唔會跌落去咧，就係譬如一對夫婦咧，佢生2個咧就打平啦嚇，即係2個咁啊生2個，咁你咪人口咪平咯嚇。咁而家係一對夫婦係生即係一個女士啊0.8嚇，即係平均。咁所以就變咗個出生率咁低咧，就變成導致就嗰個人口個比例啊，嗰個老化，即係話你後即係出嚟嘅小朋友嗰個越嚟越細啦嚇，咁啊嗰個人數嚇意思係，咁變咗就人又活得更加長壽啦，所以就變咗喺呢個狀況底下咧，我哋嗰個老年化嗰個進程會可以係去到2050年去到講緊40% 係65歲以上長者嘅嚇。嗱咁去到錢嗰方面啦嚇，咁亦都香港亦都係嚇，咁嗱。喺呢度咧就可能我要答一答馮醫生個少少問題啦。答呢個問題之前，先了解一下咧，一般我哋嘅財務嗰個狀況會有啲改變。喺我哋做緊嘢嗰陣咧，其實咧就係每個人有份工啦，咁即係意思係你有人工啦嚇，即係你有現金流啦，你賺緊錢啦嚇。但係第二方面咧，你可能有供緊樓啦嚇，供緊好多其他有好大嘅開支啊嚇，即係你係有 liability， 你有負債，但係你亦都會有收入嚇。但係去到退休嗰之後咧，呢個樣嘢會改變咗。你可能供滿咗間樓，但係你冇咗現金流，你冇咗即係你冇咗工作，所以你冇收入嚇，變咗冇現金流。咁比較 typical 啦，即係比較一般。嗱，呢個圖咧就係比較一般嘅財務安排啦。可能就譬如你喺做緊，即係左手個圖嘅左手邊嚇，咁啊係你即係做嘢儲錢啦嚇，即係我哋有 MPF 啊，咁啊鼓勵你儲錢啊，或者自己就自願供款啊，或者自己再買好多嘅一啲計劃啦嚇。 咁就儲到你退休嗰刻咧嚇，或者你唔再工作之後咧，你就有筆錢跟住退休啦。退休個狀況會係點咧？咁你就會一路喺啲筆錢嗰度用嚇。咁即係你話呢個分咧就係一個叫升傾分，即係話你一路用佢就一路會縮嘅嚇。除非你一個好穩定嘅回報你可以做到嚇，即係如果唔係咧，你筆錢咧係一路用一路縮嘅嚇。咁會出現一個狀況。咁啊，如果譬如你計到啱啱好啦嚇，即係你85歲離開呢個世界嘅話咧，咁你可能啱夠使咁樣樣啦。咁大家會面對一個咩問題咧嚇？下一頁啊，唔該嚇。如果你長壽嚇，第一你長壽嘅話，你活得比你想像長嘅時候咧，你就越嚟越驚㗎啦，就會嚇。因為咧嚇，呢個第一點嚇。第二點咧，喺呢個時間你進入咗退休咧，通常個健康狀況都可能會比較差啲。一個醫療嘅開支咧，可以一次過可以將你你個 saving 啦，即係你個儲蓄咧，可以一次過有機會會用咗幾大部分嘅，有機會嚇。即係你醫好定唔醫好啊？醫完之後你又要有足夠嘅錢去繼續去活落去啦嚇，應該咁講嚇。咁所以咧，就呢個係大家要注意一點咯嚇，即係呢個咧，所以就下一頁啦，唔該嚇。嗱，第一樣嘢就好重要，就係現金流嚇。現金流好重要嚇，即係話如果你去到退休之後，你係需要有現金流，你就唔怕你活得好長。你去到100歲、100幾歲，其實都冇乜所謂嚇。即係其實你有足夠嘅現金流去支持住你，呢個係一個好重要。即係你除咗你要有存款，第二方面咧，其實就係你需要有 cash flow， 有現金流嚇。即係變咗就，所以咧就一啲金融產品或者你好多其他嘅方式，都係應該，我覺得係某一部分你係需要處理呢樣嘢嘅嚇。咁所以你話係要，如果你話400萬，如果你活到85歲嚇，咁但係如果你100歲咁點咧嚇？咁樣樣，咁你仲有10幾20年喎，後邊有10幾年喎。咁所以嗰個會係一個挑戰。第二咧就係個健康啦嚇，健康係一個我諗係退咗休之後應該相當重要嘅一個課題啦嚇。因為你除咗你有健康，你就享受到你個退休人生啦嚇。咁第二方面咧，亦都你健康你係減少咗好多醫療嘅開支嚇。即係如果你係進入一個比較慢性或者長期嘅病患嗰陣咧，咁就你個醫療嘅開支會相當犀利嘅嚇。咁所以呢個亦都會導致嗰個即係影響個退休生活啦，亦都影響你財務嘅狀況嘅嚇。咁第三方面咧，就我諗我哋之前我哋中銀人壽做過一個調研啦嚇，就係一啲退休生活嘅有冇一啲痛點啦。其中一個痛點咧就係即係我自己都有少少忽略嘅嗰陣時做嗰度，就係嗰個照顧者嚇。照顧者其實咧喺你退休，即係你退休其實唔係你一個人嘅事，係你一個家庭嚇，一個家庭一個溝通嚇。好多時候咧就係我哋發覺有陣時有啲個案咧就係個痛點就係譬如可以進入退休啦。咁你由60到70歲，咁大家都相對仲係好健康啦嚇。咁同埋咧有個特性又唔想煩啲仔女嘅嚇。咁啊即係退休有咩嘢就唔想煩啲仔女嘅嚇。咁但係去到某一點咧嘅時候咧，就唔到你選擇，你冇得唔煩啲仔女㗎啦嚇。咁但係嗰陣時咧就可能你會進入咗年紀比較大，而你啲仔女年紀都可能會比較大。喺嗰段時間個照顧者壓力會相當大嘅嚇，即係喺財務啊或者精神時間各方面咧。咁所以咧就喺呢個喺我哋嘅呢個 survey 底下咧，咁我哋都揾到係有好多照顧者一啲嘅痛點嘅。咁所以咧就係所以亦都第三方面咧，我覺得就要有一個溝通啦嚇，即係除咗財務健康，跟住其實同一啲家庭嘅一啲溝通，亦都相當重要啦嚇。咁講到咁多好似好灰咁啊！咁其實咧樂觀啲睇咧，即係其實咧即係呢個 silver economy 啦嚇，即係個銀髮經濟咧，其實亦都喺第二方面亦都帶嚟好多嘅商機嘅嚇。咁喺即係嚟緊嗰個進程咁快咧，其實呢個增長咧，即係銀髮經濟，你會使落去嘅錢咧，其實係講緊即係342個 billion 嘅嚇港幣嚇，即係3400億啊嚇，差唔多係講緊係呢一個係一個好大嘅一個消費群組啦。第二方面咧，亦都係會個速度會幾快添啦，個增長點好快啦嚇。大家要知道一下咧，而家其實咧今次個老年化咧，其實係源自於個嬰兒潮啦嚇，即係60年出世，即係戰後嬰兒潮嘅 baby boomers 開始進入退休期嚇，但 但係呢一個年齡層咧，其實亦都係喺香港過往發展咧，亦都係喺經濟得益嘅一個群組嚟嘅。所以佢哋係有經濟能力嘅，應該係嚇，應該係有呢個群組。除咗佢哋係老化，但係呢個群組亦都係有相當嘅經濟能力嘅。所以喺呢一度咧，所以就變咗咧，個消費 economy 咧，其實係一個即係我自己睇，除咗我哋個老年化係一個挑戰啦，第二方面都係一啲好大嘅一啲嘅機會嘅嚇。咁呢個就嚇，咁我個嚇咁啊分享係咁多嚇，唔該晒嚇。
咁聽我哋再問多啲鄧生嘅問題嚇。咁接下來我們要邀請這個杜鵬教授。杜教授是這個中國人民大學人口及健康學院院長。因為中國這個人口老齡化的情況，其實是全國因為這麼大14億人口，這個差異是很大的。有些大的經濟發展大的城市，好的城市，比如上海啊、北京啊，這特別厲害。這有些情況可能比香港更厲害、更快速。還有一些以前的人口政策所帶來現在這個人口老齡化的效果也是很嚴重的。那麼杜教授在這方面的專家，那麼可以跟我們分享一下，就是在國內現在是怎麼能推行什麼政策來推動應付這個老齡化的這個挑戰的？謝謝杜教授。
好，謝謝主持人，大家好。也祝賀黃金時代基金會10年取得的成就。我呢是中文的 PPT， 我用英語簡單的做介紹。So I will start from the national strategy on proactively response to population aging. So since 2021, China has more than 14% of older people aged 65 and over. The next year, in 2022, China start to have the declining population. That's why last week, Chinese government just published a new policy to encourage the childbearing and elderly support. At the same time, we have more than 310 million older people aged 60 and over, and 220 million old people aged 65 and over. With that background, since 2021, China announced the national strategy to proactively respond to the population aging, and one major aim is to provide the basic elderly service to all of the people in need. So that's a fundamental change. Before that, only those widowed, those without children, they can get help. But now from 2021, change to all of the older people in need. That's a projection of the population aging. So we can understand why we have the national strategy, because by 2050, we will have more than 520 million older people aged 60 and over. So these people, they are born before 1990, and they can live to 60 by 2050. So that's why we can project the more than 500 million old people, they need a pension every month, and they need health care, and at the same time, they are more active, the majority of them, how to provide the service, how to encourage the volunteerism. That's the background of the national strategy. At the same time, we focus on the cohort change. Although it's a huge number of older people in China, but we separate them into several baby booms. The baby booms born in the first wave in 1950 to 1958, they entirely entered the old age by now, and the earliest age, they reached 75 already. The second is the largest baby boom, born in 1962 until 1976. They are entering the old age in the now and the next 13 years. The total number of the second wave of aged boom will be more than 330 million itself. So how can we provide products or service to these people? They are the majority of the older people in the near future, and that also is a very key issue to boost the silver economy. After 60 years, we can see the baby booms changed into the aged booms, and although in Japan, in Germany, in the United States, they also have the aged boom. But if you look at the left side, it's the baby booms 60 years ago, and now we are experiencing the aged boom until the end of this century. You can see it's a huge increasing number of the older people themselves, but also every stage of the aged boom, the number is very huge. For example, from 2010 to 2018, the first age boom is more than 140 million. They entered the old age. The second, we are experiencing, the total number is more than 330 million. And on average, every year in the next decade, more than 21 million old people entering the old age. And the third wave will be from 2041 to 2054. The number is also close to 300 million. So for each cohort, we know they are so different. We can't just provide just the same products or services like 20 or 30 years ago. Even the last baby boom in 2070s, still on average, every year we have more than 16 million old people entering the old age. So based on that, we can understand why we have the national strategy. We have to plan for the next 3 decades, 4 decades, or even longer. In the last 2 years, we can see on the internet, China announced the national basic elderly service list, including 16 items. Every province, they have to announce their list, including these 16, but must be older, must be more, they have usually 25, 26 items, including that. So generally, the national strategy, when they transformed into the practice, they focus on 3 major areas. One is to have the national evaluation or assessment system of the older people's need, and how to share the information among all of the government agencies. The second is to establish the basic elderly care service list. The last one, but very important, we guess this year, China will have the national long-term care insurance system. Since 2016, already we have 49 cities, they joined the pilot programs. But from now on, we will move to the national coverage. I summarize several points of the key challenges. One is the negative population growth. Like in Hong Kong, Japan, with the declining population, what will happen? So now every year we have a 2 million reduction of the population. But you can see if that continues, every year we may have more than, say, 10 million reduction or decrease in the near future. So that's why we have to have the policy to encourage the childbearing and fertility support. The second, with the aging of the population, we are entering a peak period of the death of the population. We can see more and more old people. The deaths will concentrate around 90 years old. So even for the care provision or relevant services, that will be postponed to oldest old, but that will be more concentrating in around 90. The third is the digitalization. We have the digital divide, but at the same time, we have the national strategy to promote the digitalization on various perspectives. So even for UN, United Nations International Day of Older Persons, they focus on the digital equity for all ages in 2021. Similar in China, we read the report 1 week ago by the end of June, last June, China has the coverage of almost 80% the internet users. And the old people, for 310 million, 52% of them, they are using mobile phones to connect to internet. And also that gives more opportunity for social participation. At least here, some, say, Douyin, you can see the most active old people on that. The left side, you can see they got good marks, almost, say, 900 million. That's a huge number. And then they play important role, very active role to tell the society, the new generation, old people, they are so different, and they can also make money from that. The right side one, during the pandemic, this old couple, they donate 1 million yuan to the Jilin province from their savings. They made the money from the internet. The last, I will highlight 5 practices to implement the national strategy. The first is why the government so focus on the elderly care service, because that's for their daily life, they can experience the progress. We are talking about smart aging, we are talking about silver economy, but for the daily life, they know, okay, I can get the service. I have the access to this kind of products. That's more important. So at least the key documents, you can see every year, major documents, major policies on this perspective. Second is high quality development. 90% high quality development focus on economic development, even for the silver economy today. But what's the purpose of the silver economy? And the happiness, the well-being improvement is the utmost target, the goal. That's why from every aspect of the high quality development, we can see that we will promote the well-being of the older people. Any products, any services, if they can help to realize that, that's the important point. Third is the Chinese model, Chinese path for the elderly care, because China has so huge increasing old persons. We can't just copy the experience from one country or one area, so we have to learn and combine the ideas with the local culture, local practices. That's the from the government policy, they said, okay, how to explore the Chinese path, providing care for the elderly. The fourth is the super-aged rural areas. China is among the 300 million old people, 1/3 of them, they are still living in rural areas. How to narrow the gap between urban and rural elderly care services with the silver smart aging innovation, how to provide service even with the remote mode to deliver or to give a diagnosis, health to provide health services. That's a new direction. The last is the digital smart aging technologies and also the data collection. We have a reach of data, but how to transform that into accurate service, into the products. So that's the next step, important points. Not just like I show, that's the current screen, the data collection in the local services. But how to connect them together, how to provide that with the daily service to the older people, that's the future direction. That's my main introduction about the national strategy and the practices. Thank you.
Thank you very much, Professor Tu. Tu 教授. Now we can have some discussion on all these interesting topics and also challenges. First of all, Dr. ARASE, the Fukuoka 100 project, it's actually a very ambitious project. 100 projects are doing at the same time, trying to actually address and prepare every one of us moving to 100 years old. How do you finance all this? You actually start from bench and then to sort of centers to home, everything. It's but how do you get the money to support all these initiatives?
ありがとうございます。オール福岡でしてますので、ビジネスアカデミアガバメント、特段のそれぞれの分野から将来に向けての費用が出ています。
So as we mentioned in the presentation, the Fukuoka 100 project is being taken on by an all Fukuoka team of business, academia and government. So of course each of these individual fields provide their own funding for their areas.
タングさんがおっしゃったように、治療プリベンションフロムキュア、治療から予防へっていうことでシフトしてますので、予防的な施策がたくさん出てきます。
And as Mr. Tam mentioned earlier, we're also very much focusing on prevention rather than cure. So obviously, the more we prevent, then the less money it takes to cure things. So we have lots of policies involved in preventing problems.
そしてエデュケーションって申しましたけど、やっぱこのことを市民の皆さんに教えていくのに、私たちは広報しないといけない。市民の人たちの将来がかかっていますので。
And of course, I mentioned education in my presentation, so I believe it's very important to educate the citizens as well in how they need to take on the problems associated with an aging population.
それと日本は人口で最先端な少子高齢化言ってますけど、スライドでシフト、政策のシフトを出しましたけれども、生涯現役、アクティブ・フォー・ライフ、高齢の人も働く、社会に出る、そういうのを進めています。もちろん認知症の方々も。
And as I mentioned in my presentation as well, Japan has one of the most aged populations in the world. We are actually at the forefront of an aging population, so we are taking a large shift in policies and how we're trying to make those who are already aging more active in society to help, and this includes those with dementia as well.
Okay, thank you very much. But in your role as the vice mayor, of the leader, of the city, and what's the most important sort of government-led initiative that prompted the whole development, including engagement, not only the community, but also like the business sectors and everybody, to actually go along the same line and then sort of embark on the very sort of ambitious project.
副市長の役割に対してなんですけれども、政府として最も大事な施策は何だと思いますか？例えばビジネスの分野における施策でもいいし、でもあくまでもその政府としての施策の中で最も大事なのが何だと思いますか？
やはり財源一番大事です。それで将来を見込んで財源の予想をもしてますので、そこを減らすような施策、改革をやってます。
So of course, the most important thing for the government is, as we mentioned, is obviously finding funds. But of course, one of our most important things that we're trying to do at the moment is to reduce the amount of need for funding. And how we're doing this is taking on very large, sweeping policy reforms.
私はやっぱり最も認知症の方々、認知症の対策をどうするかが非常に大きくこれからのウェルフェアに関わっていくかなと思っています。
And one of the major areas of this is how we take on those treatments and things for people with dementia.
Yeah. So that seems to be a major challenge, especially in dementia in every society. Then let's move on to Wilson. Wilson, you mentioned about like you had a very good analysis of the aging situation in Hong Kong at the present moment, and how we are going to, how we should be preparing for it. Yeah. And your last slide you mentioned the various components of silver economy, and of course the SAR government is trying to promote that, as mentioned by Mr. Chee earlier on. Yeah. But what's the biggest priority, you think? What will be the biggest growth area in Hong Kong in particular when we try to actually promote this silver economy?
講到中文 OK 嚇。咁我諗嗰個即係如果講老年化咧，而家我哋嗰個挑戰同埋個機會會同時會出現，就係我覺得嗰個醫療系統咧，即係嗰個
問題
嗰個，因為個承受力已經我諗去到唔好話去到老年化啦，去到而家都已經有一個幾即係特別公營嘅醫療系統咧，都已經即係嗰個負荷都好重啦嚇。一當進入老齡化嘅時候咧嚇，特別你係長壽，但係未必一定健康嘛。而家關鍵係嚇，咁所以咧嗰個公營醫療系統嗰個壓力相當大嘅嚇。咁喺呢個狀況底下咧，我覺得咧喺個即係私營嘅醫療啊，或者係另外一啲嘅醫療嘅一啲嘅體系咧，可能嗰度會係可以分擔到一啲嘅壓力啦。咁同埋另外一方面睇，亦都可能呢個會係一個機遇啦。我覺得係嚇。但係就即係如果我覺得佢係最大嘅挑戰喺香港嚟講，可能係個醫療係即係嗰個可能阿馮醫生你更加清楚啦。
所以保持健康始終係最緊要嘅。
係啦，係保持健康都好重要，因為你有啲嘢逆轉唔到，你進入咗嗰個即係一病咗之後，你特別有啲長期嘅病咧，你逆轉唔到嗰陣時，咁嗰個醫療開支或者你對個人嗰個壓力都相當會大。
咁我哋去醫管局咪得咯，唔使俾好多錢啫嘛。
係咯，咁就。咁就係佢個壓力大啊嘛嚇，開始就慢慢
好多要等啊，
係啦，要等啦，同埋你嘅等啊，個服務嘅質素、時間啦、排啊各方面，咁嗰個我覺得會係一個會即係對個社會壓力會幾大啊。
同埋而家好多人關注就係如果有啲新藥啊、嗰啲新嘅創新治療啊，點樣引入嘅時間啊，有啲醫管局都要等好耐。咁如果要去私家又貴得滯嚇。所以頭先問400萬夠唔夠？其中一個問題幾百萬幾多錢先夠咧？咁樣其實最緊要就係保持健康。你保持健康咧，嗰啲積蓄就可以用耐啲。
係啦，冇錯，呢個
即係一病咧就始終都係有個挑戰。
即係要嚟食飯好過要嚟食藥啦
嚇。咁啊，所以呢個都係好緊要，即係保持健康咧，同埋老齡化咧變成一個好緊要嘅議題啊嚇！即係點樣能夠保持住健康嚇？咁我哋睇下喺出邊咧都有好多嘅展館咧，就大家去睇下點樣能夠促進即係嗰個保持健康嗰方面嘅嚇。Then I come to Professor Du. Now so the aging the population is a real challenge in China. It's actually because the trend is going very fast on one hand. And on the other hand, the problem is very diverse. Big city, as I mentioned, is very different from, as you mentioned, the rural area. You mentioned one third of population, the age population live in rural area, and in which, of course, the economic situation is not as good, the status is not as good as in the big cities like Beishanguang and this地方. Yeah. So for the overarching policy from the government, how to really, on the implementation level, how to address this diverse situation and also different challenges, because the country is so big, and how we you say something on that?
Okay. 谢谢啊。In fact, that's the reality in China, not just among the rural-urban.But also for those eastern, central, western parts, and even for we talked about super-aged society, super-aged province. In fact, Liaoning is the province is super-aged. It's quite similar, like in Japan or other place. So even for the national strategy, they encourage the local government to have their some sub-policies to practice. For example, among the Guangdong, Macau, Hong Kong region, in fact, they are attract a lot of the young people here. They are in Guangdong province, it's one of the lowest proportion of older people.
I know Shenzhen is very young.
Very young.
Yeah.
Maybe only 7% older people.
Yeah.
So we are talking about in Hong Kong, it's about 20%, but in Guangdong province, it's lower than 10%. Just a little bit higher than Tibet. Tibet is the lowest, and Guangdong is the second. So for Shanghai, Beijing, similar. They attract more than 8 million or 10 million young people working in the cities. So for those cities, how to encourage the young people, they have more children, and also how to attract the young talents to work in the cities. That's these cities, they are richer, they have the more potential to encourage that. But we, for the other provinces, maybe the central policy, need to invest more, especially in rural areas. For example, last week, China just announced several provincial policies, like if you have older people need long-term care, every month they can apply 800 yuan per month. Now that's in 3 provinces, but the policy is by national level. By the end of this year, all of the provinces, they have to have the policy. You know, in rural areas, living in nursing homes, it costs maybe 1,500. If you can subsidize with 800, a lot of older people, they will get the professional care. So that's a fundamental change for the service delivery. I mean, that's the national policy and the local practice, local efforts, they can jointly play the role to narrow the gap between the region or maybe provinces.
Now, in Japan, they've had long-term care insurance developed for a very long time. But in China, this is very new, only starting to...
10 years. This is the
10 years.
year. 10 years.
Yeah, 10 years, only starting 10 years, you know.
Yeah.
So in terms of the provision, would that actually... I know more about the health insurance in China. You know, it's actually in recent years. You know, it's because of aging population, it's actually getting into trouble as well. So with all these added together, we'll be able to. You think we'll be able to support the aging society in the long run?
Yeah, that's very important side. In fact, in 2016, when we start the pilot programs, every province, they can have one city to join the pilot programs. Some provinces, they are more active, like Shandong province, all of the cities, they join the program. I think the background is today, people realize we have to have long-term care insurance. In fact, in the world, only Japan, Korea, China, maybe Singapore, we have the long-term care insurance. A lot of arguments about that. But with the huge number, we will have more than 100 million oldest old by 2040, more than 100 million, the oldest old themselves. So when you think about the one-child generation, they grow into the old age, how to provide the care, especially those high-quality care for the older people. So from the whole society realize that we need long-term care. The insurance is a good way to realize that. That's the point. But the difference from Japan and Korea is we just split some part from medical insurance because of the economic situation. We can't have one new insurance to collect money, split medical insurance into it. And the coverage, the level of support is relatively low. In Shanghai, for the older people, they are in bed for more than 6 months. After assessment, maybe they can get 3,000 per month. In some other cities, maybe 1,000, 1,500, something like that. But in Japan, the nursing homes maybe they support 80% to 90%. So at the beginning, the insurance is sustainable. But for the future, in fact, we have to develop new insurance program into it, not just rely on the current frame. That's really a challenge, but we have to go in that direction. So I guess in the next 2 or 3 months, we will have the national insurance system, but we can see government already published 17 policies in the past 1 year. So that will happen. And at the same time, a lot of new challenge will happen because it's not compulsory, not like in Japan and Korea. It's voluntarily, you can choose to join or not. So that will be a big challenge for the sustainability.
Now, let me ask all our panelists, the three speakers, one common question, before we conclude this session, and allow you to go for lunch. And that is, with the sort of aging population, it's been said that because people age, they retire, and they no longer sort of contribute so much towards the economic growth of the country, and the economy slow down. That's why all governments try to promote silver economy to try to make sure that there's some boosters to the economy again. The two seem to, the economy and the aging seem to go sort of in contradictory directions. So from policy perspective, so next decade will be surely the biggest challenge among our areas. This region, whether in China, in Japan, Korea, Hong Kong, Singapore, everywhere we listen to the same stories. So from your perspective, with this sort of rapid increase, how do we see, what are the opportunities there? What would be the sort of biggest sort of opportunities in terms of, especially the region, working together, towards sort of a shared challenge, shared problem, and also sharing the growth, from whatever perspective, whether it's actually through policy, research, or public-private partnerships and all that. So, how would you say? Maybe I ask Professor Tu to Jiao, you start first. Yeah.
Okay. I think maybe 3 comments on that. First, it's a very good, very big opportunity in the region, because in fact, after our talk, we can find it's quite similar maybe in Japan, in mainland China, Hong Kong, and some other countries. Like we are talking about aging, we are talking about silver economy. In fact, quite a close topic. Not say 20 years, maybe 20 years ago, mainland China may talk about how to control the population, but nowadays, similar direction to encourage fertility. So that's one opportunity. Second, we have to have an innovative way, including the AI and new technology, to innovate new products and services. Because when we talk about silver economy, it's the result, it's not the beginning. The older people, they want some new service or product. Whether we can create that, we can provide that, and then we can realize the silver economy to achieve.
So technology does play a very key role.
Yeah, the current generation, they are different. They are more urban, they are more educated and healthier, not just those with nursing home care. But for the majority of younger older people, they are very active, They want to have more culture, spiritual activities. They use mobile phones, internet, and how to create opportunities, benefit from this new generation. That's the second, the innovation of products and service for the older people. The third, I think, the last point is in this area, in this region, we can learn from each other. Like the Robert, the mayor just showed, in fact, last month we visited the Leveled company. In fact, the second biggest market is in Shanghai. They sell that in Japan, in Tokyo, but also they sell more than 1,000 in Shanghai, one city. So in fact, the new technology, new products, new services, we can learn each other and try to solve the aging issues together.
And that will change, major change, lead to major change in society. 鄧生咧？
我諗首先要如果講到係先了解啦，講緊退休呢個課題咧，其實咧呢個係一個好複雜嘅一個課題啦嚇。我諗佢涵括咗，譬如每個人又會有唔同嘅時間，譬如你60到70同70到80、80到90都變緊嘅，其實都一路唔同緊嘅，所以你唔會係一個 lifestyle 或者係停咗喺度一種模式啊！咁喺你唔同嘅時間，你係會改變唔同。咁同埋你唔同嘅個狀況咧，或者你身體狀況咧，咁亦都會唔同嚇。唔同嘅經濟狀況亦都會唔同，所以係相當一個複雜嘅一個課題。咁如果你話要有一啲嘅 solution 或者去 tackle 呢件事嘅話咧，我覺得就你好難去揾到一個產品或者一個行業可以解決晒所有問題。咁所以我個睇法應該係集合唔同嘅行業啦嚇，所有唔同嘅行業去喺即係呢個就為之一個消費 economy 啦嚇。呢個第一，第二我諗就喺香港喺個地方，我哋用我哋嘅優勢啦，譬如我哋係個金融中心，我哋喺個財務策劃啊各方面，你乜嘢產品，你乜嘢貨幣，乜嘢我哋都可以 assess 到嘅嚇。咁所以喺產品上邊，我哋係可以創新啊，嗰度係嚇幫助到，譬如有現金流。或者係儲蓄啊各方面，咁嗰個係喺唔同嘅即係你個風險，你個 risk appetite 嗰度，我哋可以有唔同嘅選擇。另外香港亦都係同大灣區一體，可以咧，我覺得咧，另外除咗跨行業咧，亦都跨境咧，咁亦都可以將個因為香港有一個好大嘅問題，個成本好高。咁而我哋同大灣區嘅結合嘅時候咧，可能可以用到個資源更加去將個成本可以降低啦嚇。咁所以咧降低咗個成本，個性價比會比較高啦。所以嚟緊我會覺得一啲跨境養老啊、跨境醫療啊嗰啲都會係一個趨勢咯嚇。咁呢幾方面，我覺得可以係即係盡量喺唔同嘅地方可以用到佢唔同嘅優勢去解決呢個問題，同埋有個跨行業去解決呢個問題咯嚇。
你講呢個都好緊要，但係你講嘅第一點咧就更加緊要，就係大家要喺概念上、思維上嘅轉變啊！就即係第一樣嘢就抌走退休呢個概念啊，係只不過喺生命你活到100歲嗰陣時候咧，只不過喺生命嘅唔同嘅階段咧，就要做唔同嘅嘢嚇。50歲到60歲做唔同嘅嘢，60歲到70歲做唔同嘅嘢。呢個你講嘅好緊要，概念嘅改變。概念改變之後咧，就可以再諗跨行業啊！你提到跨行業就係建基於香港本身嚟講嗰個經濟，如果係金融係嗰度強嘅，咁呢個我哋都可以建基方面再進一步發展。跨境亦都係啦嚇。So lastly, Dr. ARASE, in relation to the future challenges, project 100 project, what's the when you be able to finish the 100 projects and then get everything prepared, and then in terms of regional sort of partnership and collaboration, what we see to be the opportunities?
2000年に介護保険がスタートしたときに日本の少子化はもう分かっていた。
So in the year 2000, when we introduced the long-term insurance program in Japan, we actually already understood that we were going to be faced with declining birth rates in the future.
で私も実は福岡で少子化対策に関わってますけれども、 少子化はもうやっぱすごい時間がかかってくる。
And obviously, because of this in Fukuoka, we were very much involved in creating policies to combat low birth rates from a very early age. But one thing we realize is that this is a problem that takes a long time to solve.
そこで、福岡100は続きます。これからもですね。100 is 100 lives っていうことでこれからも続けますが、やっぱりこれから先は少ない人口でやっていくので、生産年齢層の。
So although you mentioned that the 100 projects of the Fukuoka 100 main project, although we finished these 100 individual projects, the project started as an attempt to take on the 100-year life. So we will continue the Fukuoka 100-year project in the future. And one thing that we need to think about is that we are going to have less population to take on these future challenges.
でやっぱり DX ロボット効率化に今力を入れてます。
So as was previously mentioned, we need to think about DX, digital transformation, and how we can utilize robots, for example.
次の目的はそのあたりに入ってくると思います。で、インフォメーション、データを持ってますので、どれがやっぱり医療費を削減するか、どれが介護費用を削減するか、効果が出てくると思うので、やっぱりその効果で検証していきたいと思っています。
And just to mention, for example, that obviously we have such a vast amount of data due to our research so far, and we can use this data to investigate how we can lower the medical costs and how we can lower welfare costs in the future too.
Yeah.
頑張っていきます。
Thank you very much. So you also mentioned about the importance of technology, the importance of information, to help us to keep healthy, lower the medical costs, and that's the most important. And one of the key themes is, as we age, we want to age in a healthy manner. We want to age in health. We don't, and that's the quality of aging, and that's very important, right? So I think time is about up for us to have lunch. So do we have time for a couple of questions from audience? Is there a question at the back?
Okay, so we have audience have a questions at the back.
Yeah. A question or comment? Feedback? Yep. Someone at the back raised their hand, right?
I think I have this answer for all you have told. The point is, a person like me reached the age of 70, 70岁. What I want a happy life. How? I have to enjoy my life, okay? But in the last 9 months, I suffered a lot of injuries. Okay. Okay. My friend sent me 8 words. 无灾无难无忧无愁 No war, no disasters, no worries. You don't have to worry, and you don't have to. Okay, something like this. How? I say, if disaster came, you can't avoid, but I can change my mind. I say, I want to be happy. So, what is the point? This is very important. Prevention is better than cure. Right? Oh, age, we're lucky
Yeah, thank you very much. So certainly, happiness, health is part of contribute to the happiness as well. This is another comment over there. In the middle.
各位嘉宾好，很高兴认识你们。我想问一下，现在养老制度的话，包括完善养老金计划，然后鼓励生育，以及提高医疗服务，还有包括发展银发经济，以及运用 AI 和人工智能来提升我们智慧城市的整个一个完善的社会系统。然后我想问一下，在座的各位，在这5个方面，包括鼓励生育，你们觉得优先的次序是怎么样的呢？谢谢。
That's a very good question. We want to start that. Yeah.
我諗總括嚟講，你講嗰啲全部都係都重要。不過如果我覺得咧，個優先序咧，我覺得就會坦白講，我覺得咧即係應該咁講，分開幾樣啦嚇，因為有啲咧你係好 urgent。但係相對冇咁重要，但係有啲咧就好重要，但係佢未必咁 urgent。咁所以你個次序就要睇得，例如譬如鼓勵生育嗰方面，呢個係一個好重要嘅其實嚇。咁但係就遠水又救唔到近火嚇。咁但係就係呢個係一樣要做，但係就要嗰個即係個人口個結構咧，係長遠嚟講咧會係有個會即係需要有個改善嘅空間咯嚇。咁但係如果你話比較即係政府如果係要比較短期啲去做一啲嘅措施嘅話咧，我覺得咧喺我正話都提過喺個醫療嗰度咧，特別喺跨境醫療啊點樣鼓勵，即係去更加可以去分擔到嗰個公營醫療嗰個壓力啊，鼓勵到可以譬如喺私營醫療同埋公營醫療嗰個分配啊各方面啊，甚至乎跨境啊香港同埋境內啊各方面，特別大灣區啊咁，我覺得呢個可以係即係有啲嘅政策可以幫助到嗰個即係當你醫療 OK 嘅話咧，其實跟住咧就跨境養老啊嗰啲就跟住可以出嚟㗎啦嚇，咁可以舒緩到嗰個問題嚇。
杜教授剛剛問的優次的問題，尤其是鼓勵生育，鼓勵生育好像比較很困難的，是吧？在新加坡推行鼓勵生育很多年，還是不太成功。香港現在也在鼓勵生育啊，還是不怎麼成功啊！內地剛剛我聽說有新的政策，就是生孩子可以有這個資助。So amongst all these priorities, how would you say, which is more important? 鼓勵生育很重要嗎？
鼓勵生育很重要，養老也很重要。我覺得剛才提這問題啊，其實很難分哪一個最重要。我覺得呢，它整個是要建立一個包容的社會，或者是說，我們叫什麼全齡友好的社會。它應該這個社會裏邊對老人、對小孩、對每個人的這種獲得感、安全感都能有幫助。你比如說，你剛才講到養老金，你講到說我們現在促進銀髮經濟。正如前邊我說，其實背後是說，現在這些老人他的擔憂、他的不安全感，他要有更高的生活質量，這種 well-being 或者 quality of life， 你的怎麼能夠給他保證？所以這個時候呢，真正反映出來現在養老問題、生育的問題，都是背後的焦慮，都是我們現在的這個服務不完善。你比如說，剛才講，雖然給了小孩一定的補貼，1個月300塊，其實也就夠買1罐奶粉的。但是如果他要上學，他要上幼兒園還很貴，他將來這個孩子，我們現在1年畢業1200多萬大學生，這是家庭裏邊20多年的投資，怎麼能夠找到一好的工作，讓他還能夠養活一個家庭？這是一個系統的，而不是靠一個單個的，所以他需要一個綜合的來發力，才能解決這個問題。要你給他300塊錢，那邊他要花幾萬塊錢去補課，他還是不願意生育，是吧？
對。所以你剛剛提的概念，全齡友好就非常重要，就是也是符合我們這個大會的一個主題，就是從銀到金。為什麼說從銀到金？就是不單是一個銀髮的挑戰，銀髮的這個經濟， 而是所以经的意思在经灵里面就看更加重要的就是怎么那个 inclusive 的时候，我都说是包容，全龄的包容，这个是很重要的。Yeah. So, Dr. ARASE, I leave you for the final words. Question asked in relation to the various priorities. I believe it's been translated. Yeah. So, how will you say about the priorities? Yeah,
Sorry,
she mentioned
in which areas?
Oh, sorry. I'm sorry. I forgot to try. I'm
sorry. The interpreting machine wasn't working.
Okay,
I do
sorry.
apologize.
The question was asked. We raised various issues in relation to, like, of course, aging, silver economy, and we also mentioned about AI technology, and also mentioned about promoting fertility and all that. As a population policy. So among all these, what should be the priority?
その中のいろんな分野があると思うんですけれども、様々な分野のどこを一番優先されていますでしょうか。
どこも大事だと思いますけど、人々が幸せになる、そこの施策を優先してます。
So although there's a vast variety of areas that we need to take on, personally I believed, as it was mentioned before, the most important thing is how we can achieve happiness. This is the area that we should be focusing on.
So the conclusion for this session is inclusiveness, harmonious is all ages. It's not about the old age. It's everybody. So with that, let's conclude these sessions, and thank you very much. And let's give our panelists a hand of applause. Thank you.
Thank you so much. Thank you. 咁呢個時候，不如我哋影張合照好嘛？ So 記念寫真撮りましょうか？我們一起拍一張合影。So let's step forward, and for interpreter, could you please, exit the stage, and then we are going to have a photo together. Okay, so get ready, and please have a look to the center. 1, 2, 3. 1, 2, 3. Few more to go. Thumbs up. Okay, let's thumbs up. 1, 2, 3. Few more to go. Okay, let's continue to boost up our energy to the summit. Okay, 好，我们继续再看我们中间的大会摄影师。Okay, so thank you so much. Thank you. ありがとうございました。非常感谢我们的嘉宾精彩的分享。Thank you.